Hi, my name is Andrew Hernandez, and I'm doing my presentation on nurse burnout. So first, let's meet the team. Who are nurses? What do they do? Well, nurses are individuals who went to school because they wanted to be in the healthcare profession. They wanted to be there to take care of patients, to take care of people who are hurting, who are injured, who are sick. They want to be there for people when they're at their worst. Nobody wants to go to a hospital. No one wants to be in a car accident, but it does happen. And thank goodness that there are people who want to be nurses and help out. Nurses, they're the backbone of the hospitals. Now, when we think of hospitals, we usually think of doctors. That's the first thing that comes to mind. And that's not wrong. Doctors are super important and super valuable in the healthcare system. Without doctors, nurses wouldn't be able to do half the things that they do. However, nurses are going to be the ones that spend the most time with patients. When you're sick, when you're in bed, when you're laying there in the hospital for hours or days or weeks on end, nurses are going to be the ones that you see for the majority of the time. Doctors are super busy and super stressed, and they're running around just trying to keep up with the patients that they have. They're trying to dole out medications and trying to see everyone, whereas nurses get to spend a little more time with their patients, doing direct, hands-on care. Now, you may think your smiling, happy nurse is just ecstatic to see you if you're in the hospital. And they are happy to see you. They are happy to help. That's why they got in the profession. But sometimes they're not always okay. Sometimes things they see can take their toll. And sometimes the stress of the job can be too much. Sometimes there's a bad accident or a gunshot wound. Sometimes there's a child that dies. These things wear on nurses. Nurses are people, and everyone struggles with emotional trauma. Nurses are no different. Now, what's happening is there's a burnout cycle. These nurses are struggling with the stressors of their job. And it's not just traumatic things like car accidents and gunshot wounds. It's not just having patients die. It's also stressors with management. It's stressors with staying in the same area for too long. Nurses face all kinds of different challenges on the job. But let's talk about this cycle. So, the first part of the burnout cycle is stress. So, common stressors for nurses are too many patients, too few nurses on shift, overbearing or out-of-touch supervisors, and of course, the emotional stress. Now, too many patients. Sometimes a hospital can be understaffed, and when that happens, you'll have nurses taking care of anywhere from 6 to 10 to, heaven forbid, 12 patients at a time, and these ratios can get really dangerous. Fortunately, in some states like California, ratios are mandated by law for how many patients a nurse can take care of. But unfortunately, North Carolina isn't one of those states. Now, another thing that can be happening is there's not enough nurses on shift. You might have some people calling in sick, you might have some people out on vacation time, or you might just have a shortage of nurses, and the remaining ones have to pick up the slack. Dying people aren't going to stop dying just because Susie called out of her shift. And sometimes there's supervisors that have been out of the game for too long. They haven't been a floor nurse in quite some time. And honestly, they put in unreasonable expectations on the nurses that are working the floor. And then let's look at part 2, the effects of burnout. So, certain nurses report going through the motions, not really feeling present, exhaustion and apathy, just like their day is a blur. When burnout is too much for a nurse, they call in sick for work. They just want to do anything to get away and get some release, try and relieve that stress. And it's not healthy, it's not safe for the patients. They're just done. Now the third part is quitting. If you've been burnt out for too long, if it's too much to handle, what are you going to do? You're going to quit. That's your breaking point. Nurses are people too, and they can only take so much. And when that fracture point happens in someone's emotional state, They want to get out. They have to get out. It's unhealthy to stay for too long. Now, that's causing a vicious cycle. It's repeating. And a problem with this repeating, it's too cyclical. When nurses leave, they leave more patients for the remaining nurses to take care of. And they're just increasing their workload and increasing their stress. And the remaining nurses, well, they're burning out quick too. And it just keeps happening and happening and happening. Good nurses get burnt out and leave. And then the new nurses that are left get burnt out and leave. And that's why there's a nursing shortage in America today. And that's kind of scary, honestly, when you think, well, if I go to the emergency room, how long is it going to take for me to be seen by someone? Now, nursing doesn't have to be a cycle of defeat. It shouldn't be. After all, it's a profession just like any other. And anyone would want to have a long-lasting, healthy, stable career. So, what are some ways to break the cycle? Well, rotating. If you've been working in the ER for a long time, maybe seeing all those trauma patients is taking its toll. Maybe it's time to move into something like med-surg, which is less stressful. It's more about interacting with healthy patients. Sometimes the switch can be a good thing. Also, ratios. This kind of falls on management's head. They need to take charge. And they need to be responsible for hiring nurses. They need to not make it an expectation that overtime is the norm. Instead, they need to make it an expectation that there'll be enough nurses coming in for shift, and there'll be enough nurses that even if someone calls out, there can be people to come in and cover those gaps. And also, retain. If the stressors decrease, if there's healthy ratios, if patients are safe, then more nurses will want to stay in nursing and not leave. And that's where the cycle gets broken. Once you start keeping nurses, once they don't want to leave, then you continue to keep more and more and more, and instead you'll get a positive cycle instead of a negative cycle. Nurses are vital. We need them. If you get into a car accident, once the paramedic drops you off, you're in the hands of a nurse and a few doctors. And we need to make sure that nurses stay vital, nurses stay healthy, nurses don't burn out. The profession needs to be healthy, stable, and it needs to last for a long time. Thank you.